guys, it's Sydney, and I'm going to be sharing with you guys my case study, which is Abdomen Case Study 2. So let's go ahead and get into it. Here's a little bit about our patient and the patient presentation background. So the patient is a 22-year-old male who's relatively healthy, and he comes into the outpatient urgent care facility, and he complains of a bulge in his right groin region. He says that this bulge is very noticeable while he is standing up and kind of goes away whenever he sits down, and especially whenever he lays down. He also says that this bulge is moderately painful, doesn't have a whole lot of pain with it, but he just says it's something that he wanted to get checked out and to see what the cause is. After the patient was checked in, there was a physical performed, and there were a few interesting findings that medical examiners noted. The first is being that there was definitely a bulge observed in the right inguinal region of the patient, kind of like the patient described, but what the doctors found interesting was that whenever the patient was asked to cough, the bulge actually increased in volume. So going off of this, examiners decided to insert their pinky finger into the inguinal region, in particular in the deep and superficial inguinal rings. And whenever the finger was inserted into the superficial inguinal ring, the patient was asked to cough again, and in this instance, a definite impact was felt and there was pressure. In addition, the patient was asked to stand and then lay in the supine position, and once they laid in the supine position, the bulge seemed to disappear. Medical professionals went on to press the finger over the deep inguinal region to check for impaction there, and nothing was felt. The only impaction felt was in the superficial inguinal ring when the patient was asked to cough. There was also some diagnostic imaging that was performed, and this is actually the results from this imaging, and this is actually showing the Valsalva maneuver test, and basically what that is the patient was asked to plug their nose, close their mouth, and blow as if they're blowing up a balloon. And this test is really interesting because it kind of forces in expiration in a low pressure environment. So the main difference in this imaging we can see, this was taken on the superior pubic ramus in the inguinal region, and we know that in the femoral triangle we have our artery, vein, canal, lymph, and the nerve. So the main difference we can see is before the maneuver, there was only the artery present, but after the maneuver, the artery and the vein was present. So that was a very interesting finding that led professionals to kind of get an idea of what the patient's diagnosis would be. Before we get into the diagnosis, I want to talk a little bit about the anatomy that is relevant to this case. So we're looking at the inguinal region, and the inguinal region boundaries are ASIS, which is the anterior superior iliac spine, to the pubic tubercle. Now this region is very special because, as I said before, it contains the femoral triangle, and the femoral triangle contains the femoral artery, nerve, vein, lymph node, and empty canal. Now something else that's very interesting about this region is that it provides an entrance and exit to the abdominal wall. And because of this, there is often herniations that can occur that whenever the abdominal wall is pushed into this inguinal region, which is why we see bulging. Something else I want to note about this region is that there are two different inguinal rings. The first one is the deep inguinal ring, which is located back here, and then we have the superficial inguinal ring that's located more superficially. And these two rings are very important because oftentimes when herniations occur, they exit through one of these rings. Now, as I mentioned, there are two rings, the superficial inguinal ring and the deep inguinal ring. And running between these inguinal rings is something called the inguinal canal. So actually something really interesting about the inguinal canal is that in males, it contains a spermatic cord. And we know that the spermatic cord functions to carry sperm from the testes through the penis when ejaculation occurs. And these things kind of all tie together and are very important for function and stability because the fetal testes from the dorsal abdominal wall actually form the deep inguinal ring. So whenever there's a problem with one of the rings, there's often herniation, there's often issues with ejaculation and things of that nature. Now let's get into some potential diagnoses. So our first potential diagnosis is inguinal lymphadenopathy. Now, inguinal lymphadenopathy occurs when there is inflammation, and it's actually nonspecific inflammation of the groin area. Also, we would notice a swollen groin of lymph nodes that could most likely be due to virus or bacteria. Our second possible diagnosis is a hydrocele. And a hydrocele is essentially a fluid-filled bulge that occurs when there is fluid in the scrotum. And finally, we have an inguinal hernia. And we have two types of inguinal hernia. We have direct inguinal hernias, which occur when there's a bulge in the posterior wall of the inguinal cavity, or we have an indirect hernia that occurs when there's a bulge in the inguinal cavity or the groin. So just to talk a little bit more about one of our potential diagnoses is inguinal lymphadenopathy. So whenever a patient has this condition, they will often present with a swollen, usually painless, hardened bulge in their groin. Now, something to note about this is that patients usually have some other symptoms, such as fever, fatigue, and night sweats. In addition, something that's really important about this condition is that it's generally almost always caused by an underlying infection, and this infection can be due to a bacterial or virus infection. Now, if we think about our patient that we were presented with, we know that he had really great lab results. His white blood cell count, everything, complete blood cell count was completely normal. So this is why that I do not think that our patient has this condition, because he did not present with an underlying infection. The next potential diagnosis is hydrocele. And hydrocele occurs when there is a fluid-filled bulge that is in the scrotum that is actually peritoneal fluid between the parental and the visceral layers of the tunica vaginalis. Now, while this could maybe possibly be our patient's diagnosis, the patient did not complain or was not observed to have swelling of the scrotum. So this is why we can kind of scratch this one out and assume that our patient does not have this condition. Now for our differential diagnosis, I believe that my patient has a direct inguinal hernia. And just to kind of go over the difference again between a direct and inguinal hernia, we know that an inguinal hernia occurs when there's an impact felt in the deep inguinal ring. And this is because the hernia is actually protruding through the deep ring. Now, I think our patient has a direct inguinal hernia because during observation, there was an impact felt in the superficial inguinal ring, which is where direct inguinal hernias occur. Now, kind of going on that, something interesting about a direct inguinal hernia is that whenever a patient is asked to cough, there's actually an increase in intra-abdominal pressure, and that allows for the hernia to kind of be enlarged and increase in volume. And we also saw that during the physical examination of our patient. And then finally, something else that I would expect to see with our patient that could maybe happen if this wasn't treated is issues with the spermatic cord, because the spermatic cord, like I said, kind of travels in between both of the inguinal rings through the inguinal canal. So we would expect to see maybe an issue with sperm traveling from the testes all the way out to the penis. So there are some different treatments you can do for a direct inguinal hernia. The first and most common treatment is just surgical repair. So the patient would undergo surgery and the hernia would be removed. Now, this is the most common procedure that's performed, especially if the hernia is causing issues or pain to the patient. There's also a very low chance of recurrence after surgery is performed. Now, there's some other options that are non-surgical. The first one is a tissue repair. So basically, what's going to happen is naive tissue is going to be used to repair the hernia, and there will be no stitches required. So this is kind of a less invasive way and something that patients may opt for, especially if their hernia is not causing them a lot of pain. And we can also do a prosthetic repair, and a prosthetic repair is actually a tension-free repair with a lower hernia recurrence rate. So of course, surgery has the lowest recurrence rate, but this is the second most. So that's another option that patients may be recommended to by their medical providers. Finally, you can do a laparoscopic repair, which of course is very minimally invasive. And there's actually two types you can do. The first is called the TAAP repair, and that's where the surgeon is going to actually go into the peritoneal cavity and repair all possible hernia sites using a mesh. The second type is a little bit even less invasive, and that's the TEP way, which occurs when the surgeon does not actually enter the peritoneal cavity. They just go around the peritoneal cavity and place a mesh surrounding the hernia to protect and help to just kind of help the organs that are surrounding the hernia. So a lot of people actually just kind of leave hernias untreated, and usually it doesn't always cause a problem, but if it can be very life-threatening. So if a hernia is left untreated, the first thing that could happen is that strangulation could happen. So basically the blood supply to the tissue surrounding the hernia will be cut off. That is a very, very, very dangerous and fatal situation. In addition, severe inflammation can also occur. So necrotizing enterocolitis can occur, which is severe inflammation of the intestines. So that is also a very deadly and life-threatening situation. And then finally, to wrap it up, sepsis can also occur. So yeah, there's a whole lot of things that can occur if the direct or any kind of hernia is not treated, and it's very important to get treatment and to get this hernia removed or repaired as quickly as possible. Okay, thank you guys for listening to me and for watching my case study. I hope that you guys learned a whole lot about direct inguinal hernias, and here are my resources.